All right, welcome everyone, and thanks for joining us today for our webinar. Today we're going to talk about rethinking benefit design and workplace policy. I think this is a subject probably very near and dear to everyone's hearts. In the last 24 to 30 months or so, we've all been struggling with how to work in our new work environment. And most importantly, how to help our employees adjust to the new world and how to move forward. So we're going to talk today around attraction and retention, products and programs that people are both adding and subtracting in some cases. Our research lead on this project, Sera-Leigh, Ghouralal, and Tammy Fennessy from American Eagle Outfitters are going to join us in this conversation today. And we're really going to try and examine how employers can help better set up an attraction and retention strategy within their workforce that will keep people at work, productive, engaged, and satisfied. And so without further ado, Dr. Sera is going to go ahead and lead us through our research findings. And then Tammy and I are going to have a conversation about how American Eagle Outfitters approach this particular challenge and the best practices that they put in place to help their employees. So Sera?
Thank you, Kelly, and thank you everybody for joining us. We're glad to have you with us today. So I'm just going to go ahead and get started. Today we're going to talk a little bit about the overview and background of this study, the research questions and methodology, our findings, summarize everything we talk about, and then we're going to move on to some Q&A with Tammy. So as we all know, the COVID pandemic really reshaped a lot of things in our lives. And one of those things really was how employers had to think about benefit plans. Employers were really struggling with a lot of issues with their employees, such as increased absenteeism, presenteeism, and attraction and retention, as we've all seen with the Great Resignation and the Great Migration. So employers really had to think about how they would change their benefits to attract and retain employees that would then turn into better productivity and job satisfaction. So they had to look at things like mental health coverage, caregiving, remote work, even benefits customization. There were a lot of gaps in the benefit plans that the pandemic highlighted, and these really addressed some employee pain points that were coming out of the woodwork as the pandemic continued. A few things that employers had to kind of keep in mind were really mental health coverage, like I said, the remote work and flexibility, and that caregiving was becoming a really big issue during the pandemic. One of the things that we also have seen in these couple of years is that the employees are looking at how they're being treated by their employers. So employers were kind of using, or at least as the pandemic started to expand, they had to use empathy and compassion as some guiding lights in designing benefit plans. So at IBI, we had some research questions that guided our research that we wanted to know about. So I'll just read these through and then we'll talk about these and the results we found. What are employers' perspectives on benefits that will attract and retain employees? In what ways have employers engaged with employees to inform benefit redesign decisions? In what ways have employers changed benefit design since the pandemic? And what benefit changes or strategies do employers believe are working and will be continued? And which ones will be eliminated? So a little bit about our methodology and our samples. IBI surveyed 60 employers across the United States. We kept a smaller sample size for this because we also wanted to get some open-ended questions and qualitative data. So we actually surveyed HR executives, benefit managers across the country. We had responses from about 28 states, with the heavier responses coming from California, New York, and Florida. And industries that were mostly represented were retail, manufacturing, construction, and healthcare. I'm going to break down the size of the companies that answered our survey. So we had 61% were less than 2,000 employees, which we considered small. 26.7% were mid-market, which is about 2,000 to 5,000 employees. 8.3% were national accounts, which was 5,000 to 100,000 employees. And we had 3.3% of our responders being from jumbo employers, which is more than 100,000 employees, I'm sorry. A snapshot of the company's workforce demographics, 48% female, 47% under 40, and 63% associate degree or higher, and over 50% being white or Caucasian, and 20%, roughly 20% Black and African American, about 17% Hispanic Latino, and about 9% Asian. Now, this is the snapshot of the employees within those companies that we surveyed. So some of the descriptive analysis that we did, we found that 40% of the companies that we surveyed did make changes to their benefit plans since the pandemic began. 65% of the companies said that employees' preferences were considered when designing their benefit plans, and 80% of the companies said that they seek feedback from employees regarding satisfaction of newly implemented benefits. One of the questions we asked was, what happened to your benefits over the last few years? So what is the status from about 2019 to after, let's say 2021 into 2022? We conducted this survey in July of 22, so we asked up until that point. We wanted to know what you offered before the pandemic, what you expanded or added during the pandemic, and what you kind of did away with post-pandemic. As you can see, many of them offered basic benefits prior to the pandemic: health insurance, 401k, PTO. And during the pandemic, they added financial wellness, incentives for completing wellness programs, caregiver leave, behavioral health, and remote work options. And they expanded life insurance, behavioral health, professional development, PTO, and health education. As you see, they no longer offer it post-pandemic: paid parental leave, tuition assistance, weight management exercise programs, financial wellness, and subsidized childcare. Now, that's a surprising finding. However, I do want to introduce a caveat here that of the 60 employers that we did survey, 32%, as you can see here, said that they no longer offered paid parental leave. That's 19 out of our 60 employers. Of the 19 employers, 17 of those companies were smaller group employers of less than 2,000 employees, and 2 were mid-market employers. So it does make sense a little bit that the smaller employers may have had to cut leave or benefits that they added during the pandemic for financial reasons. The larger employers in our survey did not reduce or remove the paid parental leave. And then the industry with the highest number of employers reducing or removing the paid parental leave was manufacturing, mining, and construction, then professional and scientific technical services.
And Sarah, I just want to kind of point out here that I think we were a little surprised by some of these results. Certainly, PFL, PPL being removed. But if you remember during the pandemic that we had some of these leaves being mandatorily offered, right? It makes sense that it's certainly in the small business group that employers who typically did not offer those leaves before the pandemic probably went back to not offering them. So I don't want this to look like national account or even mid-market and national account size employers are all taking away these leaves. I think these were temporary additions, and now they're kind of going back to their norm. Just a little aside. And, we have the data that shows the size groups who removed the benefit, and it makes sense to us. But we're making some assumptions.
Yeah, and that's certainly in our data. As I mentioned, none of our large employers indicated that they removed this leave, and it was 17 of the 19 that said that they removed this leave were small employers. So it does line up. So one of the other things we wanted to know was, how do employers rank decision-making factors when deciding for benefit plan design? So we asked our employers to rank on a system of 1 being most important to 5 being least important. What was the most important decision-making driver that informs benefit decision-making plans? And you can see we asked pre-pandemic all the way projected to next year. As you can see from the slide, financial and cost mitigation always remains the most important influencing factor when deciding benefit plan design. Then you can see prior to the pandemic and each year since, you can see particularly in 2020 that, except for 2020, attraction and retention has been the second most influential factor after financial. And that's interesting to us because of all of this that we've seen with the Great Resignation and the Great Migration. Employers realized they needed to start making their benefit plans a little more attractive or juicing it up to increase their retention. Competitive advantage has been the least influential factor from 2020 to now, but prior to the pandemic, it did have a greater influence. Employee feedback, interestingly enough, kind of remained middle to low range within throughout the years, regardless of pandemic or not, which we also thought was interesting because 80% of our respondents said that they do value employee feedback and when implementing new benefits, and 65% said that they do use employee feedback to introduce new benefits. And business performance improvement has also remained kind of within the same range. One of the things we looked at after we got this ranking data back was that attraction and retention became more important after 2020, and our respondents indicated that their turnover also increased after 2020, which we've been seeing as a trend in the last couple of years. So companies are placing more importance on benefits that will attract and retain employees as a way to perhaps mitigate the fallout over the greater turnover that they're seeing in the aftermath of the pandemic. So as you can see here, in the circles, it's the percent of employee turnover that the companies have had in the last, in these years. So it's steadily increased. And 2022, as I said, we did this survey in January. So 15.6% was up to Q2 of 2022. That's how much employee turnover was experienced. And you can see the lower the numbers, the more important attraction and retention is, because 1 is the most important ranking. And you can see this trend as the employee turnover increased, the rank of attraction and retention became more important in decision making for benefit plan design. So I'm returning to our research questions here. We asked employers open-ended questions for them to type in text responses. And we wanted to know what were their perspectives of benefits that will attract and retain employees. So what do employers think their employees want? And these were our top 4 answers: mental health and EAP, additional PTO, work from home options and more flexibility, and telehealth. We also wanted to know in what ways employers engage with their employees to inform their benefit design. So remember, we said that 65% of the companies stated that employees' preferences were considered when designing benefit plans. Employers use fairly standard ways of getting employee feedback: employee surveys, focus groups, departmental meetings, casual conversations with their supervisors. Employers have said that they consider feedback when making benefit plans decisions. But as we saw in the ranking, it's not a driving factor. In fact, it has remained middle to low range in importance. So, it would make sense that attraction and retention is about the employee. So you would want employee feedback. So you would think that, employee feedback would be a little more important in decision making than we saw in our results.
And Sarah, I just want to comment on this as well. I think that pre-pandemic, we all had mechanisms in place to gather employee feedback. We've all taken the yearly annual pulse survey, right? That many of us had no idea what was done with that information, nor did we ever hear back on what they were going to do about it, right? So some employers were ahead of the curve. They would publish a paper after their employee survey every year and say, here are the things we're going to address. Great, that got them so far, but this is a different world. I don't think an annual pulse survey is going to inform benefits anymore. And it's not enough. And so I think more of our sort of leading edge employers are really getting into many more, where possible, in-person town halls, even virtual town halls, where you're getting direct feedback from employees about the things that they need and want to be included in their benefit designs. Having employee focus groups is becoming huge. Instead of just water cooler conversation, really formalizing that process where employees feel heard and they feel like their employer cares about what they think. And then probably the biggest piece of this is the action, right? What do they do about that? So I gave you all this feedback. What is the result of that conversation? What is the result of that feedback? And will there be changes made because of it? Obviously, much easier in smaller organizations than it might be in larger organizations. But if there's a practice in place where even conversations with supervisors are documented, that people are asking for things or wondering about how they get access to certain benefits, if there's a process in place where those can be reported up, tracked, and addressed, I think employers are finding the feedback much richer and not just what they want and need, but after programs and products are implemented, how it's going. Do they like it? Did it work the way they hoped that they wanted it to work? We are all in the situation where we hear employees say that they don't like this and they need that and they like that, and then you give them that and then they're still not satisfied. So putting a much more regimented process in place for employee feedback and resulting triggers of an event, I think is the best course in this new world. Go ahead, Sarah.
All right. So after we asked employees what ways have employers changed benefit plans since the pandemic, and we saw this in the slide before, where they added in mental health coverage, additional PTO, work from home options, and medical coverage expansion. So this is we didn't ask employers to expand on the medical coverage expansion. It was a table they had to choose from. But from chatting with other employers, we're thinking that might be adding fertility benefits or, adding in more conditions that they cover. And then we asked what benefits, changes, or strategies do employers believe are working and will be continued post-pandemic. Mental health and EAP was a big one. It doesn't seem to be like employers are going to be removing this, which is a great thing. Additional PTO and unlimited PTO has come up quite a bit, and it's something that employers think that employees want, and it's something that they're hearing from employees that they want. And work from home options. There's this huge return to office right now or hybrid type of work environment that employers are trying to adopt, while I'm not sure, and a lot of the data shows that their employees want more flexibility, more remote work rather than return to office. It's a big debate right now, but this is what we found in our data. So I'm just summarizing everything we just talked about here. 40% of the companies we surveyed may change their benefits plan. 65% said that they consider their employees' preferences when designing their benefits plans, and 80% said they seek feedback regarding newly implemented benefits, as Kelly was just talking about. We saw that cost mitigation and attraction and retention were the most influential factors in benefit redesign and decision-making. Employers believe mental health, PTO, and flexible remote work options will attract and retain employees. And they mostly use surveys to gather their employees' feedback. But what do they do with those surveys, I think, is the next question we would want to ask in the future. During the pandemic, main changes to the benefit plans included increasing coverage options, PTO, mental health coverage, and remote work options. And beyond the pandemic, employers think that they're going to continue covering mental health, offering additional PTO, and trying to find a balance with remote and hybrid work options. In thinking about this research, we do wonder about the DEI initiatives being used. If employers are saying they're listening to the employees, but they aren't quite paying attention to the employee feedback because it's so low ranking on influential decision-making factors, then maybe some important factors are being missed. For example, mental health coverage to include culturally competent providers, or understand how the workforce perhaps may be reflecting a demographic that is being sandwiched between childcare and parental caregiving of elderly parents. So employers are, I think, finding it a little difficult to both listen to their employees and keep an eye out for the bottom line. But IBI talked to some of our employers to get some guidance on maybe what is happening, what has happened with them, and a little bit of lessons learned, caution going forward, and advice going forward. And some of the things we learned from our employers and from our membership was that the pandemic obviously brought about strategy change. Cost management was always number one, and now they have to really focus on employee attraction and retention. So the employers all agreed that the way that leadership and employees both think about the benefits changed drastically in the pandemic. And a lot of employers were focusing on financial wellness and mental health before the pandemic, and the pandemic kind of really exacerbated the need to magnify those issues in benefit plan design. And then other employers acknowledged that prior to the pandemic and during the pandemic, they were actually really more focused on cost management than making their benefit package more attractive. And it was difficult finding a balance there. But coming out of the pandemic, a lot of the employers we spoke to, they said that they did redirect their focus to ensure that their employees were being valued. I suppose a lot of empathy and compassion developed within the pandemic period. Another thing, one of the main things really that our employees said, that it's all about your people. So you have to understand your workforce demographics. It's key when you have to design benefit plans. They highlighted the importance of diversity, equity, and inclusion. But a lot of the employers we talked to admitted that they were in the early stages of implementing strategies and access to care that is diverse and equitable. So, for example, one employer discussed their health access as having good models for the LGBTQIA+ community, but that they needed more inclusiveness for people of color. They all said that the pandemic has really lit the fire in getting these maybe what was on the desk to do kind of initiatives, getting it done quicker. And they also talked about the importance of employee feedback and employee education. So employee feedback, the employers stress that you should really be listening to and engaging with your employees. One of our employers said that following the pandemic, their directive from leadership was do not do anything to negatively impact benefits for your employees, which I think is a great directive to have, and to be vigilant about the repercussions of benefit solutions, and ensure that big ticket items such as parental leave are not negatively affected by changes coming out of the pandemic. And also not just to listen to what your employees want, but listen to what they don't want, what they don't think is not working, what maybe you're wasting money on that could be redirected and used in other places. And employee education, the employers we spoke with, they agree that educating employees on what benefits are offered is really important. Taking the time out to have meetings or curate technology that is easy and friendly to use so that your employees can understand that their benefits are not just medical or health related, but they have support for other aspects of their lives, and have that information upfront, readily available, using as least jargon as possible, and also be mindful whenever making changes to benefit plans that your employees understand what the changes are, what they mean, when they take effect. And moving beyond the pandemic, our employers, they said proceed with caution, but also with empathy. So the pandemic kind of resulted in some rapid fire changes being made in the heat of the moment to keep employees happy, involved, engaged, productive. And the pandemic also exacerbated a lot of gaps that were found in benefit packages. So moving forward, leadership is tightening purse strings, and cost mitigation may take precedence, but employers caution that while changes have to be made and costs will increase, it is imperative to continue to listen to your employees. Thank you. We will now move on to some Q&A with Tammy and Kelly.
Yeah, so before we move into the Q&A with Tammy, I just kind of want to round out what our lessons learned are here. I think that one of the main things that I kept hearing from employers was around uncertainty and this whole idea of being empathetic with your workforce. We've just lived through, 2.5 years of complete uncertainty. And so as you're designing going forward, helping employees to understand the benefit changes that have happened, that will happen or might happen, especially around your return to office strategy. That's one of the big uncertainty. We all heard the research around everyone wants to work at home. Everyone wants a remote work capability, except we also see research that shows that people who work at home aren't as productive as we thought they once were at the beginning of the pandemic, or that they're not as happy with their situation. Our prior research project showed that people still have big problems with workspace and work equipment, and quite frankly, staying connected to their coworkers and their managers. So when you're designing these products and programs going forward, if you can do so with some certainty, it helps employees plan, obviously, what the benefits are that they will have available to them, but also what their schedule looks like. If you're going to tell employees they can come into work 2 days a week and you don't pick those 2 days and everyone is in the office a different day and nobody's connecting anyway, that's not really a strategy. And so if you're able to provide them with, it may not make them the happiest employees by saying they have to come to the office 2 or 3 days a week. But if it's the same 2 or 3 days a week, every week, always, they can plan for that. And so you're taking away some of the uncertainty that they've lived through these last, almost 3 years, and helping them to plan. And that, I think, helps people feel more settled at work and supported. So we are so happy to have Tammy Fennessy from American Eagle Outfitters with us today. Tammy sits on our board and gives us great advice with our other employer board members around not just how these challenges are being thought about, but what they've done to address them within their business. And probably more important for our employer friends out there, if it has worked or if they're still working on it. So, we want to hear about best practices, but we also want to hear about cautions. So I'm going to ask Tammy my first question, and we will monitor. If you have any questions, go ahead and put them in the Q&A, and we will read them live with Tammy. But I have a couple of questions to get us started while you all start thinking about what you want to ask. What has been the guiding light at American Eagle for benefit design decision-making, and has that path really changed in the last 2.5, 3 years?
So I think one of the largest guiding lights for us has been around democratizing care. I think that did start prior to the pandemic, but it was definitely fueled and put into immediate action during the pandemic. So that's what spawned us to open actually 4 health centers that we have right now, and offer up, low to no cost services for folks who are employed for us, regardless of being on our medical insurance. So that was definitely a big part of it for us, is trying to level the playing field. Their income was an uncertainty. We wanted to, at least give them put their minds at ease about whether they could get care or not, instead of, throwing them to the wolves. So it was definitely a conscious effort on our part. I think also too, just whenever we're looking at our policies, the pandemic spurred a lot of things. The George Floyd incident spurred a lot of thought. And I think, we look at our plans now from an equity lens, no matter what program or plan we're looking at and how long it's been in place. So I think, there've just been a lot of changes throughout the pandemic, that we've taken very seriously, and really from, the equity standpoint and everything that came out of the pandemic in regards to, racial disparities, really resonated with our population. And they, our population is very vocal. They do expect us to make, decisions and pivot. So, and that being said, I think, one of the things that's permeated through the pandemic that we still, have learned so much from is in regards to, how we are talking with our associates. I think in the beginning of the pandemic, it was, we were trying to be there and be as paternalistic as possible and really show up, and practice what we were preaching. And we were telling our full-timers, we're going to take care of you. It's okay. We want you to come back. We're going to make sure you're okay. And we did that. But at the same time, we opened up the floodgates to all of the uncomfortable conversations that in the past, I think a lot of, even leaders, managers were like, that's, faux pas. Those conversations are at home. They don't come into the workplace or what have you. And now, they are welcomed. And I think that's amazing. It's really refreshing. But in the beginning, it was uncomfortable. You didn't know how far you should go.
You bring up a really good point. I said probably, I don't know, a year and a half into the pandemic, we were having a webinar, and I said to my panel of employers, I feel like we have come full circle from the old days. In the old days, many employers were very nervous about asking ethnicity in an eligibility, enrollment file. Now we are so far into their lives and their business that sort of employer social responsibility line is gone.
Yeah.
But I think it's a really good thing, right? So it's not that we didn't want to be involved or know about our employees' lives. It was a line that, quite frankly, employees had drawn a long time ago and didn't want Big Brother to know anything about them. Mm-hmm. I think that it speaks to this whole idea of we need to stop talking about work-life balance. It's just life balance. Those things are the same thing. Work and life. You're working in your home. You're working at work. It is all one thing. It's life balance. And so if we're going to address it that way and take down that wall, I think we stand a better chance of getting true and real feedback. I have a question for you, though, about those conversations. Although they're now welcome and sometimes can be uncomfortable or a little bit painful, because they're now willing to tell you what they want, don't like. Not that they weren't before. But how do you help supervisors and frontline managers and even leadership be prepared for those conversations? Because you're talking about people, especially our HR staff, mm-hmm. who've also been through a really hard period and are suffering burnout and, sometimes stress, and because of all these new things that they had to learn and do. How are you helping employers and supervisors be comfortable with those conversations?
I love that question, because it's something that we're actually having active conversations about that currently. In our last survey, we heard from our population that they really think we've got a great benefits package. They love that. They have no idea how to navigate it. But, and they do, they filter the feedback, back to our team, which is wonderful. They point them to benefits when they have a benefits question. I think we've done a job over the years of trying to make sure that operations isn't burdened with what's going on in the benefits space. So they know they can come to our team, they can direct them here. They're not going to get lost in the system if they do so. But we are in the process of trying to develop tools so that our managers can have like a laminated one-pager on mental health, to be able to say, okay, here you go. I know you're having a rough time. I'm not trained that way, but I know where these resources are. And doing things like that to just try to make things more front and center, because that's what we're hearing in our surveys is they love the benefits. They just wish that they could easily answer the questions when they're being asked them on the front line.
I think
And
that's such a valid point is, we talk about this scenario all the time where, in manufacturing, a frontline supervisor sees Bob standing in his machine. Clearly, Bob is not okay. Bob is just standing there staring up at his face, but his supervisor's like, I can see Bob is in trouble, but I don't know what to connect Bob to get him out of trouble, right? So
right.
it seems like a no-brainer, but just training your frontline supervisors and staff in what benefits are available and how to hold their hand and get them to them, I think is huge. And it costs you nothing. It costs you nothing to be able to train them. So that's awesome. That's a win-win that right there. I'm so glad to hear you talk about that. So you talked a lot about DE&I, and, I think that all companies are certainly aware. Some are further along than others in having an actual strategy. I see a lot of companies who've hired someone to be their head of DE&I, and I applaud that. But I think the companies that are trying to really get boots on the ground and figure out how to address it are companies like yours, who, first of all, understand the data. Like, who are your people? And I feel like, again, we're back to the future, right? 20 years ago, segmentation was the biggest thing since sliced bread, right? We haven't heard about it in a really long time. But now, having these surveys, having these conversations with people, you're getting a much better idea of who your people are, who live in a rural area, who are in a food desert, who don't have access to care, who maybe because of their ethnicity don't have, it's not within their culture to ask for help, how you address those barriers. And then the biggest one probably for most right now is the financial barrier, right? I have to choose between groceries or going to my mental health counselor. I choose groceries, right? So how are you addressing, I know you can't be all things to all people. We will never make every employee who works for us the happiest employee in the world. But how are you addressing having a benefit plan that's flexible enough, has some flexibility within it to address those DE&I barriers?
So I definitely, I love this question because I'm fortunate in that I'm very involved in like the National Coalition of Healthcare Purchasers. So that's one place that I've leaned into a lot, to be able to kind of really peel back the onion, even on our data. I have, I also am lucky that I have like 7 years of data for medical or prescription drug or dental data. So, I have done my own mining for quite a few years, but to your point, it wasn't with the ethnicity data pulled into it. So I had the fortune of working with the CDC on the Leading by Example project. And we did a deep dive into both of our distribution centers. And it was so enlightening. I think a lot of employers, and I just, by talking with them, like usually the data is what's paralyzing. And even yesterday I was actually at a meeting and they were asking how do you pull that in? Where do you get that ethnicity data? And we all have EEO1 data. But I think the first step is actually like working with your internal people. We're fortunate in the fact that like our VP of Employment Law is also our Chief Diversity and Inclusion Officer. So to, have those conversations with that team, he is like super invested in making sure that we're doing the right thing, but also looks at it from that legal lens. And I do think a lot of companies get really like they get in the mud and stuck when they start thinking about, wow, well, if we pull this in, what are we going to find out? And then what are we going to do about it? And I think to get over that is a huge win, not just for your company, but for your employees, because we did it. And we found out so many great nuggets of information for our lowest income populations that are struggling the most. And they're living in the healthcare deserts. They're living in places where they're poverty, there's a lot of poverty. There's just, it's not the communities themselves, the zip codes are known for having issues, so it gave us the visibility to be able to really make some quick actions and help those types of populations. But also to your point, like, those are there are two distribution centers. We've got 1,000 stores, we've got a corporate population, and I know I've had a lot of conversations with other employers. We have a lot of point solutions. We do. And I think one of the things that I look for in a point solution is truly to address an issue that has been brought to me through our committees, through our networks, which is what we call our ERGs. But to be able to talk with people and actually hear their concerns and what's keeping them from coming to work, what's keeping them from thinking that they can come to work tomorrow.
Right.
You know, those are the things that we're trying to lean into to say, okay, well, we may only have like 0.5% of our population that might take advantage of this benefit. Adoption and surrogacy is one of them. You know, it's like, it's not a big ticket item, but for the folks who need it most, it goes so far.
Exactly right. Yeah. And that goes to another good point. I think that, you know, Sera-Leigh talked a little bit about this in the research. Employers shouldn't just be looking at the benefit products and programs to add to their benefits. They might have to look at what they're investing in already that's not working or that no one is using, right? So, you know, I think about some of these big programs that have a pretty big PEPM ticket with them, and you're paying for your entire population. And if less than 1% of the population is using it, and not for nothing, if less than 1% doesn't really like the program, you didn't get great feedback on it anyway, or outcomes, here's some money you can put in another program that they really do want, right? So it's just that whole kind of evaluation process. And to that end, that leads me to my next question. How has the pandemic changed expectations around leaves? Because we saw in the research, you know, some smaller employers are taking away those leaves that they put in temporarily. And I have to believe that that is a huge takeaway for those who took advantage of them.
I couldn't agree more. Yeah, no, I definitely, it's disheartening. It's, you know, and it is sad. I mean, I understand. I mean, you know, people have their budgets. They have to, you know, do what they need to do to keep their companies afloat. I think, you know, and I don't know if all the employers on this call would you know, agree with me, but I do feel like the federal government, you know, they did not come out with a full-blown paid family leave. We've got, you know, the sprinkling around the country. We're in all 50 states. So, you know, so I think it's 13 states now that do paid FML. You've got more, at least 5 of them coming on, you know, in the next like months to a couple of years. And I'm sure many more after that will, you know, start looking at this. From my perspective, I mean, we've got 40,000 employees, but only 7,000 of them are actually full-timers. And from our perspective, I mean, making it not matter what state you live in is an important thing to us. And we want people to be able to, again, going back to equity and everything else, we want to be able to, you know, put that forward to our population to give them an opportunity. And we're definitely going to be doing actually enhancements, not takeaways in this space for parental leave and caregiving leave going into 2023. So I'm very proud of that for sure. But I think too, even just looking at some of our policies was extremely important. Last year, we made changes in regards to like the waiting period for short-term disability. I think for so many years, decades, companies have been giving better benefits to corporate populations than to the non-exempt populations, you know, and that's where I was saying, like, when we're looking at our policies, we're looking at it to say, wow, that's like glaringly obvious that it's not equitable.
Yeah.
You know, so we made the waiting period the same for everyone. And going into January 1st, we're making the bold move to offer up benefits on the day of hire. So short-term disability benefits, day one.
That's awesome.
You know, so that, yeah, they're not having to wait 6 months like they would have in the past. It's you know, just breaking down those types of barriers to folks who, if they want to work for us and they're, you know, 6 months pregnant, come on.
Yeah.
You know,
it's the very definition of equity.
Yes,
it is.
It is.
And yet, you make a great point in that I see many companies focusing on, you know, sort of the halo benefits around equity and diversity, but they're not looking backward at what are we already doing that's not equitable? We talked about in our last webinar about creating equity among new hires versus current hires. You know, you got a rock star who's been with the company for 10 years, but you're giving somebody a $10,000 sign-on that's starting new. That's going to feel pretty ouchy to the guy who's been there 10 years and has been working overtime trying to fill an open position, right?
Absolutely.
So, you know, just looking at equity across the board, I think is super, super smart. So we have a question from the audience. The survey showed that health education was one of the expanded benefits. Does this include topics like Health Insurance 101 for your employees, not just your supervisors and your directors, improving overall health literacy, et cetera? So are you doing anything around helping employees understand what that benefit is?
Yes, we are. Yeah, definitely. We have actually, and we've reintroduced all of our live visits. So we are back on site. We're going out, visiting our distribution centers twice a year, meeting with our associates one-on-one during our open enrollment. I mean, we definitely did a lot of communication, but we also created brand new videos on each of our benefits, to make sure that we were just trying to drive home just the key points. We're in the midst actually of revamping all of our orientations to do the same thing, to simplify it. Because I think, we got into the weeds too much too early. But being able to, I think just, educate around, this is what you've got. I think with the other piece that we did, and we implemented this about 15 months ago. We went with a platform and just we have everything in one spot now. No matter if you're part-time, if you're full-time, they can go to their mobile application and get all of their well-being programs. They can get all of their incentives, but they can also access a care guide, which is a really important step for us. And we know that we have a very young population. They definitely adopt technology, but when things get rough, they don't want to use the technology. They want to chat with somebody. They want to talk to somebody. So that has been a very successful strategy for us because, a lot of them just won't get engaged. And if we can get them engaged in the well-being programs and have fun with their benefits, then when they need them and it's not so fun, and we're hoping they know, they've got it kind of ingrained on, okay, that's right, I can chat with that person and they can guide where I need to go.
I actually had one employer tell me, and I remember this was something that we tried years ago. It didn't work, by the way, but they're relooking at it, is you can't enroll. They do electronic open enrollment, on YBR or whatever website they use, right? You can't finish your enrollment and hit submit until you do the online orientation. And they use, a company that does the cute videos with the avatar, blah, blah, blah.
Yep.
But you must learn your benefits before you can hit enroll, or you get no benefits. It's a trap. I get it, and they offer it in, 5 different languages and, the whole 9 yards, right? So at least people, and it's snippets, here's your medical, here's your mental health, here's your pharmacy, right? At least, as an employer that they've been exposed to some sort of, you're not asking them to go hunt and peck and find it themselves. They've been exposed to at least the high level of what's being offered to them. And then they have a platform to ask questions, right? So, okay, I didn't get that whole thing on pharmacy benefits. I don't know. I don't understand what the copay is, and I don't understand what rebates are, and I don't understand any of that, right? Like, what does that mean? And they have somewhere to go, right? So I applaud all the education we can give employees as they come on board. I'm going to ask you the next question, and we talked a lot about this. When you get feedback, do you use a process in which you give that feedback back to employees? So you're listening. We talked about all the ways you're listening. Do you have a process in place to tell them how you've listened to what you're doing about it?
I think we do. Yes.
Okay.
I think when, especially because I'll give you an example. So when we were looking at traditional versus non-traditional family building, one of the things that we did was we circled back with our Real Pride network and put it out there to the Real Pride network and our associates at large. If anyone has ever gone through surrogacy, or an adoption, we want to talk to you. We want to interview you. We want to understand what's going on, in your journey, because if you haven't been through it, you have really no idea what it's like. So those are the kind of things that we're doing, there were frankly quite a few people I spent over an hour with, talking about what they went through, what were the obstacles, what kind of support do you think you needed, what do you wish you had had, how, what did you run into that you just weren't expecting? And I think it gave us a really good sense as to, what they wanted. They also wanted more equitable benefits in regards to having time off, when a child is brought into the family.
Yeah.
And, that was, and to being able to level set, I think, to find out like, okay, well, what's that number? Like,
right.
What do you want? Like, what at the end of the day would make you say, okay, that would be equity.
Yeah.
I feel okay with that. And I think having those conversations and those agreements, I mean, when they see us announce the benefits, usually we reach out to them, those folks who participated first, so that they can
that's
know,
awesome.
we heard you, this happened, this is what we're doing, you're getting a sneak peek, and they can celebrate that moment, so that then when we go forward with the rest of our population, they know they were part of that.
They were contributors. And that's all supposedly employees say they want to be, right? I want to contribute to the conversation. I want my voice to be heard. And I want to know that you're not just sitting there nodding at me. You're actually going to do something with my feedback and consider it, right? I work for an employer a very large employer who took the survey information and tallied it and actually produced it for the entire organization, good, right, wrong, or indifferent, because you get some complaints in there that you don't necessarily want to share, but and then put a structure in place that said, so here were your top 10 concerns. Here's our answer to those top 10 things, right? Maybe, and some of them are hard to hear. We just don't have budget for unlimited PTO, or we just don't, we don't have enough staff to be able to implement something like this that you asked for.
Right.
And while it didn't necessarily satisfy the exact person's hunger for that exact benefit or product or program, it gave them an explanation of why you were making the decision you made, and they felt like part of the conversation. So I really applaud being able to give that direct feedback to the people and kind of making them feel special for helping to design a benefit program. I mean, what more could you ask for? Now we all have to.
I was just going to share like one other example that, because we were talking about before, like reviewing all of your benefits that you have in place so that, you can make those decisions, those hard decisions of like, what, X, Y, and Z need to go away. And I'm going to bring on some others. And we, in regards to caregiving, we did a survey with, I think 3 of our networks that we have, and asked them, because we were seeing such low utilization of our backup care. And obviously, I mean, we're still coming out of this, so we're not forcing our people back into the office and things like that. But we have heard, I think probably everyone has heard, caregiving and going to childcare and getting your new child into daycare, it's hard. It's like harder than anything. I've never seen the market this way. So we surveyed all of those groups and just asked them flat out. We said, we're not seeing it. We're not seeing you use this benefit. But we're tentative to take it away because we don't know what your position is. Like, would you use this if we put it in place again? And it was a resounding yes. Do not take it away. We do love it. We were holding on to our days until the end and things like that.
Okay, I was going to say, what was the reason that because you're not the only one that has told us that. We have so many employers that put in caregiving, thinking that it was going to be this explosion. And their utilization was really crappy. Yeah. And it was a combination with many of them, those who didn't even know they had it. Okay. Never read it, didn't read the emails, didn't get the flyer. I got a magnet. I don't know what I did with it. Right.
Yep.
And then those who were trying to arrange their schedules around it and saving it. And then for whatever reason, may not have used it by the end of the year. It wasn't the end of the year when they asked them the question, et cetera, et cetera. And so I'm happy to hear, because in our research, caregiving is like, it's huge. It's one of the biggest needs out there, and not just for childcare and for children, but for parental caregiving or family member caregiving, et cetera. And so how are you helping employees kind of keep that together in their heads, knowing, okay, I have a mother who lives with me, who I'm financially responsible for, who gets ill, who just came out of surgery. I have to stay home with them. Is that FML? Do I take PFL? How do I figure that all out? And, where do I go for those answers? How do you address that?
Well, that's a tough one. I don't
Yeah,
have a clear-cut
it is.
answer to that. Yeah, no, it's definitely a tough one. I think, like I said, I mean, we're looking to do some really positive things next year in the caregiving space because, yeah, not everyone has the PFL and or
Right.
PFML. So we're trying to, again, just, level the playing field. But it's interesting because I know when we analyzed our data, one of the things that made it, I think, easier to sell to leadership was the fact that we were seeing definitely like the lowest of income was getting hit the hardest by this, taking time off with no pay. And honestly, it was only like an average of like 3.5 weeks that they were taking. But I mean, that's detrimental to someone who's living paycheck to paycheck.
Oh gosh, yeah.
So it helped us to build a very solid business case around the fact that like we have to do this. We have to help people, during their time of need, because it's not like this happens all the time. I mean, like I said, we've got a population of, 40,000, part-timers can definitely qualify for FMLA. And we're only seeing about 100, that fall into this space. So I guess, again, I think it's just, leaning into it and really looking at your numbers. I mean, it's not, I think a lot of times you talk about these types of benefits and finance is like, you're going to blow it up.
Exactly right.
Yeah. I think just doing that gut check and really looking at your data to understand the real landscape.
Yep.
And,
That's awesome. Okay. I'm going to ask you one more question here from the audience. What is one caution you would give to employers going forward that is a lesson learned for you, that you are either looking at or changing your strategy around going forward? What's a watch out?
I would say, I mean, if I'm comparing it to what happened in the pandemic, just because I think in the pandemic, everything was, drinking from a fire hose. Anything that you had in your mind of like what I would love to do for, our population, they were like, do it and do it yesterday.
Yes. Yes.
It was like, we have to put this in place. We have to take care of our people.
Yeah.
I do feel, from my standpoint, and I know I've alluded to it, I've put a lot of, point solutions in place. Don't underestimate the time and energy that it takes to manage all of that. That would probably be my gotcha.
That's a good one.
It does take a lot. It does. And I think you have to pace yourself and really prioritize what can you really handle and do effectively, because we're really trying to manage and watch that utilization super closely and understand it. And it is a challenge.
Well, and to that end, I think the opposite side of that coin is maybe it's time, and you said some of this, to get back to basics, because during the pandemic, we were all just kind of flapping around, right? Oh my God, oh my God. And we did. Many employers put in many, many, many point solutions because we had to wrap our arms around employees to keep them safe.
Right.
But now looking back, we need the data and the outcomes data and the work it's going to take to see if those point solutions are all working or not. It's hard to rip them back away if you put them in already. We get that. But the baseline to start, right, is kind of like, can we get back to the things we did well before the pandemic? Hopefully we did well. Preventive care screenings, immunizations, getting children back for preventive care, chronic conditions, making sure people feel safe going back to the doctor, that there's the barriers to the care that they maybe had before the pandemic that have been exacerbated, like financial or deserts, etc. Addressing those things that kind of existed way before the pandemic, right? Maybe we need to fresh start here and say, okay, I know we did these things well let's build on that and do them well after, because quite frankly, a lot of those back to basic things we did back then were money savers and satisfiers for employees.
Absolutely. Yeah, no, I definitely do agree. And I think, definitely, like we had alluded to telehealth before and things like that, leveraging the things that even, didn't work until the pandemic.
Yes. Yes. Totally agree. Well, listen, I want to thank Sera-Leigh for her hard work on the research. She did a fantastic job. And Tammy, as always, thanks for your expertise and your advice to other employers to help get them to the stage where American Eagle is, where you're really listening to your workforce, you're applying the things that they're telling you. And hopefully this all is a win-win in the end, because your employees are satisfied and you're getting the benefit of attraction and retention. So thank you everyone for joining us today. We appreciate your time. The recording will be sent out to all attendees, and the deck for today's presentation will be available for IBI members on our site. Thanks everyone. Have a good day.
Thank you.